Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about one of the injuries that we sometimes will see in the child's foot. Now, in saying this doesn't happen in younger children most of the time because the tissues are much more elastic, so you don't get sprains. But an ankle sprain can happen in youth and even older children because what happens is you twist that ankle and you pull on those ligaments and the ligaments tear. Now, if you look at the ankle and you say this is the outside of the ankle, or the bone on the outside of the ankle, what we call the lateral malleolus. This is the inside of the ankle, the medial malleolus. There's a huge ligament on the inside called the deltoid ligament. That's hard to sprain. I don't think I've ever seen it in a child where they've sprained that ligament, and very rarely in adults. On the outside, you have the anterior talofibular ligament, so a ligament that comes right out the front of the ankle. You have the posterior talofibular ligament and the calcaneofibular ligament, the ligament that tilts down to the calcaneus, to the heel bone. So as you injure it, you're going to go anterior talofibular, calcaneofibular, and posterior talofibular. That's the order that you will sprain them. The severity of the sprain depends on those ligaments are injured. Most of the time, you will sprain the ankle as opposed to break the bone if you get an ankle sprain. So really what it comes down to is you're going to either break the bone or sprain the ankle, usually not both. If you twist the ankle and sprain that's a common situation where you'll start hurting on the front and then down by the heel and then on the back. What can you do, or how can you sprain that ankle? Well, if you're stepping off a curb funny and you twist it, you can actually sprain that ankle. If you step in a hole, say on a soccer field or football field, you can actually sprain an ankle. Or sometimes if you're landing funny, you're jumping up, shooting, and you land on somebody's foot and twist your ankle, that can do it as well. All those can sprain the ankle, and it can be a pretty good injury. So what's the treatment? What would we do in children if they sprain an ankle? Number one, the best thing is to rest, ice, compression, elevation, right? RICE. Rest, meaning you want to limit activities if you can, or at least limit the motion that's causing the injury. Most of the time, that's why we put people in an ankle sprain, both as a protection so they don't resprain it, but also it takes the pressure off. It doesn't allow you to do that injury that continues to strain that ligament. So the advantage of an ankle sprain, or of an ankle brace in an ankle sprain, is that you can continue to function. You can continue to do some of your activities, and even sometimes, depending on the severity of the sprain, return to your regular sports and regular activities with the brace. Ice, anytime you do an injury, inflammation hurts. Decreasing the inflammation will reduce the pain. And so that's what the purpose of ice. Compression actually helps as well keep the swelling down, but it also supports that ankle. An ankle brace a lot of times can do the compression as well because it's actually tight enough around that ankle, keeps it from swelling, keeps it from moving. Elevation, when you're able to in your home, elevation means anything, putting your leg up above or putting the injury above the heart to decrease swelling and decrease pain and allow it to recover like it's supposed to. So that's usually a lot of times what people will do. There are ways to speed up healing. One of those is Dr. Christopher's bone and tissue that can actually sometimes heal more quickly. Or we have a form of MLS laser, a type of laser that actually uses two frequencies of laser, one to decrease pain, swelling, and one to stimulate healing. And the advantage of this laser is it literally does that. We take an ankle sprain that typically takes 4 to 6 weeks to heal, and we cut it down to 2 if you're doing it on a regular basis. And the regular basis means at least 2 to 3 times a week. We can actually reduce it. I usually recommend 3 times a week for 2 weeks, and most of the time they can get back to activities without risk of making the injury worse because it's healed significantly in those 2 weeks with the help of the laser. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 300, ankle sprains in children. Although they are not as common as they are in adults, we do see them, especially in athletes. So